So, I have this thing. This weird little habit. It's like a tiny little voice in my head that just won't stop telling me to do things a certain way. I know it sounds silly, but it's become kind of ingrained. Let me tell you about it. Ever feel like you have to do things a certain way, or you just can't relax? Like, the way your keys are arranged in your bag or the order you wash your dishes? It's like, even the smallest things can become this huge deal. I mean, who else feels this way? We all have a friend or know someone who's OCD, or maybe you're the one who's watching this right now. Whatever the case, we're going to make the most out of this training as we present scientific, medical, and nursing content. In this presentation, we'll cover what went wrong, understanding the underlying causes of OCD, prognosis, what to expect in terms of long-term outcomes, hallmark signs and symptoms, how to recognize OCD. We'll also discuss common test results and how to interpret them, treatment options, nursing diagnoses and interventions. OCD is when someone has obsessions, unwanted thoughts that keep coming back, and compulsions, repeated actions to deal with these thoughts. There are two types of OCD. 1. Simple OCD. Repetitive behaviors don't really get in the way of daily life. 2. Complex OCD. Repetitive behaviors make it hard to do everyday tasks. In both cases, people have unwanted thoughts and feel they must do certain actions to cope with them. The exact cause of OCD isn't known, but researchers have found 1. Brain changes. Some people with OCD have larger basal ganglia. These brain areas use more energy. 2. Genetic link. OCD can run in families. 3. Related conditions. Connection to Tourette syndrome. Possible link to strep infections. 4. Learned behavior. OCD might be a way to cope with anxiety. The coping behavior stops working over time. In short, OCD likely results from a mix of brain differences, genes, and learned behaviors, but we're still learning about its causes. Prognosis. Ups and downs. People with OCD have times when symptoms get worse, exacerbation. They also have times when symptoms get better, remission, stress factor. Stressful events can make symptoms worse. Benefits of therapy. Can make good periods last longer. Can make bad periods shorter and less severe. Without treatment, the person might find it harder to function in daily life over time. In simple terms, OCD symptoms come and go, but treatment can help manage these cycles and improve overall quality of
repetitive thoughts and behaviors. Need to achieve perfection. Preoccupation with thoughts and behaviors that impede ADLs.
Treatment. First choice. Cognitive behavioral therapy. Helps change thought patterns. Makes repetitive behaviors less necessary. It involves exposing the person to what they're obsessed about, teaching better ways to handle the anxiety. Second choice. Medications. If CBT alone doesn't work, doctors may prescribe some medications such as Anafranil, Prozac, Zoloft, Paxil, and Luvox. In simple terms, treatment usually starts with therapy to change thought patterns. If needed, medications can be added to help manage symptoms. This part is especially for our dear nurses, as I know how important it is for them to identify the appropriate nursing diagnosis for the cases they handle. Nursing diagnoses for OCD cases are ineffective individual coping related to repetitive behaviors, ineffective role performance related to inability to perform activities of daily living, and powerlessness related to the inability to stop performing repetitive behaviors.
Accept that the person needs to do repetitive behaviors. Don't criticize them for these actions. Acknowledge their need to perform these behaviors. Don't stop them from doing repetitive actions. Preventing this can increase their anxiety. Let them have time to perform their behaviors. Slowly decrease the time for repetitive behaviors. Explain how this helps reduce compulsions. Help the person recognize what leads to repetitive behaviors. Show other ways to handle anxiety. Help them replace unwanted thoughts with positive ones when triggers occur. Thank you for watching. I hope you enjoyed this session and found it informative. Don't forget to like, subscribe, and comment below. We'd love to hear your thoughts and suggestions on other psychological topics you'd like us to cover in future videos. See you in the next session, and take care until then.